बस रोशनी में देखिए, रोशनी में, इधर उधर मत देखिए। कितना एस्टिग्मेटिस? Iol Edof. Now 2 degree means that he has against the rule astigmatism, and we should be making the incision in the horizontal meridian. We can make it here also, but that way your nose will rub against my handpiece, although it is a convenient position for me. I can do it here also. But here I will have to use my left hand, or else I will have to switch my seating. So we will do this. I will not switch my seating, we will do it with the left hand. A slightly blunt knife. When you inject this lignocaine, there is some irritation in the tissue, and patients usually have some distraction. रोशनी में नहीं देख रहे हैं आप, बार बार टोकना पड़ रहा है मुझे, उसके बिना काम रुक जाता है, टाइम लगेगा फिर। अपना काम याद रखिए, आपको रोशनी में देखना है। So this is one way you decrease the oblique illumination, and it will help you in getting a better glow, and at the same time patient will have less light, so he is now less glared. My entry was sudden, so we have a flap tear here already made up, and I will be using this flap tear to propagate the rhexis. Which had gone out a little bit, then I have brought it back. So as a result we have a large rhexis, not a bad option, because large rhexis prevents capsular phimosis. Side port दीजिए, ये क्या दे दिया? And once you have done this part, then you can increase the illumination, because now once you have made the lens very opaque by hydrodissection,
the patient will not have much.
The patient can tolerate it better. Although for that you need to have a good hydrodissection, which we are failing to do this. It doesn't matter. Left hand. And now we can switch on our illumination, oblique and coaxial both, and this will improve my view.
Sir, last one is only क्या ये वाले?
ये फिल्टर्स हैं वही ओब्लिक ऑफ करने के लिए। देखो इसको घुमा देंगे।
सर ये ऊपर वाला।
अरे यार, ये देखो रेट्रो इल्यूमिनेशन ऑफ हो गया, ये रेट्रो ऑन हो गया, ये ओब्लिक ऑफ हो गया, और ये दोनों चल गए। तुम थी घर पे कल?
मैंने जैसे माइक्रोस्कोप पे सर्जरी किया।
कोई डरावनी पिक्चर देखी थी क्या?
नहीं कुछ नहीं, भैया से बैठे बात कर रहे हैं।
रोशनी में देखिए, रोशनी में।
पहले हुआ कभी? सर इससे पहले एक बार हुआ है भैया को, लेकिन बहुत टाइम हो गया इसको।
तो विशाल से बात तो हो। उसको रिजल्ट दे। नहीं साहब है, हम भी हम क्या करना है, तो आगे दो बच्चा, तो मानसिक बात का उसको 0.5 आधा टाइम पे बात नहीं करो। नहीं ऐसा कोई में 5 नहीं है, दो इनके बीच में 5 नहीं है, दो अपना 5 के बराबर। This machine produces some bubbles, rather they are not produced, they are already in the in the tip, and when you use the power, they simply prolapse out. Now we didn't do very good hydro, and that is why our nucleus is not getting rotated well.
इसमें न्यूक्लियस एसी में नहीं रहना होता है ना, बस उसी में बस रोटेट करना होता है।
Why do you want to bring it into AC? What is the advantage? भाई AC में लाने से आपका एंडोथेलियम के पास हो जाएगा ना सारा प्रोसीजर, and it will cause some damage. You don't want to damage your endothelium, so let it be in the bag. But once you have dissected them in pieces, then you can bring them, because now they are very small.
सर आज पेशेंट था टोटल आईडी ओल्ड आईडी न्यूक्लियस क्लोरोसिस ग्रेड 3 उसका एकदम आइडियल था सर पेशेंट, उसका कोई भी प्रोग्नोसिस नहीं था।
कर देते हैं।
प्लान नहीं किया था पहले तो
प्लान में क्या करना था?
बस खुद का मेडिसिन
ये मशीन तो उपलब्ध है ना यहाँ पे? अरे मशीन तो यहाँ रखी हुई है।
नेक्स्ट टाइम से
Now this is epinucleus, which is soft, but it may need some power because it has some form also. So putting some power helps you because that it makes your procedure a little more fast. It will ultimately come into your tip, but being a little larger, thicker tissue, it may require, the power helps. So we need IA.
इसको करते एक इम्पोर्टेंट चीज अगर याद रखनी है तो क्या है, क्या ये बस इस चीज का
No, I don't follow any such shortcut. No shortcuts. You have to take care of everything. What you are trying to do is you want a very simple solution so that you have to put less effort. But there is no alternative to taking care of everything. Rather, I would say that good surgery is like 1 and 1, not 1 plus 1. The troubles will compound like 1 and 1, 11. They will not add up. So don't be like, this is one thing I should take care of. No, you have to take care of everything. I'll give you an example. You have done a nice hydrodissection or maybe a good nuclear extraction, and you do a PC rent at the time of
putting the
cortex removal, then what good does it do? Visco. So there is no single step which you can omit and think that I can do like this. रोशनी 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 में देखना है बराबर, बहुत आसान काम है, करते रहिए, चूकिए मत उससे। ये इसका हमेशा अनफोल्डेड ही निकलता है। देख रहे हो कैसे
हाँ सर
अनफोल्ड,
ये तो वेरी इंटेलिजेंट.
सांप की तरह. And the company has no clue that this is happening and they are not taking any corrective action. आइए. Have you ever seen a IOL causing a PC rent?
Yes sir.
Rigid or foldable?
Really.
Even you can cause this with a foldable lens. So again the same issue, that everything has to be perfect. If good surgery is like everything perfect, and if you see, for example, if you don't make a good incision, then it will cause leak, shallow anterior chamber, it will cause iris prolapse and progressive meiosis. So how can you ignore any one step? It is just not possible. If you ignore any one step, it will compound like 1 and 1 11, not 1 plus 1 11, 2. And as you can see, his uh, anterior lip is not very good. It is very thin. So this will cause some healing problem, a distortion in astigmatism. It will increase my SIA. But I'm not worried about it because we already had some astigmatism in this meridian, so maybe we want this astigmatism to go flat. So we can always, so we'll flush the anterior chamber of the visco first. See these swirls?
Yes sir.
This is all visco which is coming out. I'm pressing the posterior lip so that it is flushing. और दीजिए. So we keep on flushing this. रोशनी 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 भूलिए नहीं, आप क्यों भूल जा रहे हैं बार बार?
Tali.
रोशनी में देखना है बराबर.
Cotton.
And he is fine. So what I have, there are two issues here. One is distorted wound causing astigmatism, and another is poor sealability. So it is well sealed.